We're here to talk about one of our healthcare system's greatest challenges, and that is the rising cost of prescription drugs. This issue affects patients and consumers, hospitals and providers, health insurers and taxpayers, Republicans and Democrats, independents alike. Poll after poll shows the American people want solutions, and yet when it comes to lowering prescription drug costs, President Trump is once again all talk and no action. Under his watch, healthcare is getting more expensive, premiums continue to rise, and the number of Americans without coverage continues to grow. In fact, the Commonwealth Fund just released a report this week revealing that since President Trump's election, 4 million Americans have lost their coverage. This president is literally taking America's healthcare system backwards. But we can't let that stop us from exploring ways to move America's healthcare system forward. It's time we build on the successes of the Affordable Care Act. I'm proud that when millions of Americans were being bankrupt by medical bills, as a member of the Senate Finance Committee, I helped write the bill that would end lifetime limits on coverage. I'm proud that when some were working to price gouge cancer patients, I was working to close the Medicare Part D donut hole and make medicine affordable to seniors and families. And yes, I'm proud that because of the health insurance marketplace and the expansion of Medicaid, nearly 800,000 New Jerseyans were able to get covered when they were not before. But just because I'm proud of our progress under the Affordable Care Act doesn't mean I am satisfied. I won't be satisfied until we make universal health care a reality for every man, woman, and child across America. That's why, as we work to defend the Affordable Care Act from Donald Trump's attacks, we must continue working to build a better health care system for New Jersey families. And it's clear that for many patients, the cost of prescription drugs is just too damn high. For anyone who has struggled with a chronic condition like high blood pressure, diabetes, or depression, the ability to afford your medication is not just a matter of health, it's also a matter of wealth. It's about being able to support your family, do your job, succeed in school, and achieve your dreams. But in recent years, I've heard from parents of children with severe allergies who felt powerless when the cost of life-saving EpiPens went through the roof. I've heard from workers who've had to choose between paying for groceries or buying their insulin. I've heard from doctors frustrated to find out that their patients aren't taking the medications they've prescribed. And I've heard from policymakers on both sides of the aisle about the challenge that rising prescription drug costs pose to the sustainability of programs like Medicare and Medicaid. Now, these challenges won't be solved overnight. Some of the problems we're grappling with involve abusive behavior by bad actors in the marketplace. In recent years, we've seen investors treat pharmaceuticals like bets to be placed on the gambling room table. At the same time, we've seen companies purposely do everything they can to keep low-cost generics out of the marketplace, leaving patients at their mercy. Unfortunately, President Trump and his Republican Congress have done absolutely nothing to bring down costs. We heard the president make wild promises about lowering drug costs, and we heard wild promises about their tax bill being a benefit for workers and consumers. Well, I didn't buy what President Trump was selling for a second, and for good reason. We now know that the 10 largest drug companies have announced no plans to use their tax cuts to deliver savings. And 5 of them have already spent $45 billion of their tax cuts buying back their own stock. That's a slap in the face to every American who has ever had to skip a refill or break a pill in half. It's clear that, especially after these tax cuts, the drug companies have the financial means to lower costs, but that doesn't mean that they will necessarily do the right thing. That's why we need to make sure our laws support healthy competition in the pharmaceutical marketplace. Today, I'm pleased to announce my support for stopping the pharmaceutical industry from keeping drugs expensive, the SPIKE Act, offered by my friend and colleague, Senator Ron Wyden of Oregon, the ranking Democrat on the Senate Finance Committee. It's simple in terms of what it calls for. It requires America's largest drug companies to explain exorbitant price hikes. because ultimately it's taxpayers who have to shoulder the costs. This isn't about cutting into drug companies' profits or stifling innovation. It's about holding companies, for example, like Turing Pharmaceutical, accountable when they decide to raise the costs of Daraprim by 5,000% for no reason beyond profit. Secondly, I'm announcing my support for the CREATES Act, a bipartisan bill to help ensure generic manufacturers can access formulas and bring low-cost alternatives to market after brand name patents expire. Look, I'm as strong an advocate for intellectual property rights as anyone. I raise the intellectual property rights of New Jersey innovators at every chance I get, particularly on the Senate Finance Committee with our trade ambassador who comes before us, or in my role as a senior Democrat on the Senate Foreign Relations Committee when I engage with other countries in the world that basically violate our intellectual property rights. But our patent system wasn't designed to forever keep innovations away from the American people. It was designed to help innovators reap the financial rewards that they deserve while ensuring over the long term we all share in the scientific progress. We must prevent more cases like that of Revlimid, a cancer drug that was slated to become generically available, but whose manufacturer intentionally hid its formulation from competitors for years. The CREATES Act gives generic manufacturers a better shot in our courts when they encounter this sort of shenanigans. It's a way to make sure that federally required generic drug samples are actually accessible. Here in New Jersey, we're proud that we drive innovation in pharmaceuticals, and we're proud of our commitment to providing every family with quality, affordable health care. But I reject the notion that we have to choose between helping families afford medicine and keeping New Jersey's pharmaceutical industry on the cutting edge. It's a false choice. This is the United States of America. I believe we can and must do both.